I'm washing my hands. Hi, my name is Andrea. I'm going to be the nurse taking care of you today. I came in because I wanted to do an assessment on you.
Okay.
Can you tell me your name and date of birth?
Dina Carnavale, 9/25/61.
Okay. I have some other questions for you. Where are we right now?
Cincinnati, Ohio.
Good. What's the current year?
2019.
And what are you here for today?
A checkup.
Okay, great. So we got our vital signs taken up front. We get a heart rate of 72, a blood pressure of 128/80. Respirations were even at 18, and temperature was 98.7. So I'm just going to start by feeling your pulses here. If you can just relax your arms. Good. Okay. Nice, steady, even rhythm on both sides. I'm going to start by just assessing your head and moving downwards throughout your body, okay? So I'm palpating the head. I'm not feeling anything, lumps, or seeing any lesions or feeling masses. The hair's evenly distributed. Is there any pain when I touch your head up there?
No.
Okay. I'm going to take a look at your eyes. If you could just look straight at my nose here. Okay. Pupils are equal, round, and concentrically reactive. Just follow this in towards your nose. Good. Okay. I'm going to look at your eyes here. The sclera is nice and white. Conjunctiva's pink. No drainage. Are you having any changes in your vision?
Nope.
Okay. So I'm going to have you just read a couple things for me here. If you could read this line.
DHJBS.
Good. And then I'm going to have you cover your right eye.
Okay.
And read the same line.
DHJBS.
Good. And switch.
DHJBS.
Great. Okay. And then one other thing I'm going to have you do is keep your head still and just follow the pen with your eyes, okay? Good. So extraocular movements are intact. I'm going to touch your nose here. Is there any pain when I touch the sides of your nose? Okay. I'm going to just take a look up your nose. If you can lift your chin up. Great. The turbinates are nice and pink. There's no drainage. And I'm going to press on your head here. Is this hurt up here when I press? And how about down here?
Nope.
No. Okay. So I'm going to look at your ears next. Is there any pain when I'm touching on your ears? Okay, your ears are nice and symmetrical. All of the skin color is appropriate for ethnicity. There's no masses or lesions.
Okay.
I'm just going to take a look in your ears now. Okay. Any pain when I pull on your ear?
No.
Okay. Tympanic membrane is intact. It's nice and pearly gray. Good. And then the same on this side. Intact, nice pearly gray, no redness or drainage or any swelling. So I'm going to have you next just open and close your jaw for me. Good. Good. Okay. Any pain with that?
No.
Okay. Smile real big. Show me all your teeth. Good. Squeeze your eyes shut like you got soap in them. Good. Okay. Can you stick out your tongue? Good. Wiggle it side to side. Good. I'm going to take a look in your mouth. And a good dentition. There's no bad smelling breath. The oral mucosa is nice and pink. Can you lift your tongue up for me? Good. Same under the tongue. Pink, moist. And this is the clean one. Maybe stick out your tongue one more time and say ah.
Ah.
Good. Okay. So we had rise of the soft palate and the uvula. Okay. Next, I'm going to just feel around your jaw here for your lymph nodes. If anything hurts, just let me know. This is the preauricular lymph nodes, the postauricular lymph nodes, submental, submandibular. Nice, soft, tender, mobile. This is the superficial chain. I'm going to do one side at a time, sorry. And a pain there?
Nope.
Okay, and then the deep chain. Okay, good. So I'm feeling your throat, the trachea is nice and midline. Is there any pain here? Can you swallow for me? Good. The thyroid is appropriate in size. There's no masses, no tenderness there. Next, I'm going to listen to your carotid arteries. So I'm going to have you take in a deep breath and hold it. Good. Good, and you can breathe out and take in another deep breath and hold it. Good. And you can breathe out. Okay. Good. So the carotid pulse was nice and regular and even on both sides. There were no bruises that we heard. The next I'm going to do is I'm going to touch you with this cute cotton ball. So just say now when you feel me touching you. Okay, so I'm going to close your eyes.
Now.
Good.
Now. 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 Now.
Okay, good. Okay, so the next thing I'm going to do while you're sitting up is to listen to your heart and your lungs. Your expansion of your chest is nice and symmetrical. You don't appear to be in any respiratory distress. Are you having any chest pain or trouble breathing? No. Okay. Okay, so now I'm going to listen to your lungs. Sorry, I'm going to go just right down here. Okay. And I'll have you lift up this arm. Good. Good. And then the other. Okay, good. So now I'm going to listen on the back side of your lungs. If you can turn just a little bit. Good. That's good right there. Okay, take some deep breaths for me. Good. Great. Okay, so stay seated like you are. I'm going to have you say out loud 99.
99.
Good. One more time.
99.
Good.
99.
Good. Okay. So the breath sounds were clear bilaterally. There's normal tactile fremitus over the back of the lungs. So next I'm going to listen to your heart sounds.
Okay.
And so we have the the aortic valve. And the pulmonic valve. Tricuspid, sorry. And the mitral. I'm going to listen again with the bell, the aortic valve, pulmonic, tricuspid, and the mitral. Okay, good. So normal S1, S2 was heard, no adventitious heart sounds. There's one thing I forgot to do earlier, so I'm going to I'm going to hit this, and you tell me if you can hear it on both sides equally, okay?
Yeah.
Same on both sides? Okay. So next, do you hear this?
Mm-hmm.
Good. And then this?
Mm-hmm.
And which one's louder?
The front one.
Good. Okay. And then this side? Sorry. Okay. Hear it?
Mm-hmm.
Okay.
Yes.
And which one's louder?
The front one.
Okay. Great. have you lie down for me. Yeah, if you could a little bit. I'm going to look at your neck here. So there's no jugular venous distension. Okay. And I'm going to pull the bottom of your shirt up.
Okay.
So the abdomen looks nice and symmetrical. The skin's appropriate for ethnicity. There's no lesions or any skin breakdown. I'm going to take a listen to your belly here. Okay. Normal active bowel sounds in all 4 quadrants. You can see some aortic pulsation, which is normal. Next, I'm going to just lightly touch your belly. If anything hurts, just let me know. Okay. Any pain so far? Okay.
No.
So the abdomen is soft. There's no tenderness or guarding. I'm going to go a little deeper now. Any pain with this?
No.
Okay. Pull this a little bit further up. Okay, so there's no evidence of hepatomegaly or splenomegaly. Go ahead, and I'm going to have you sit back up for me. Okay, great. So I'm going to, if you could scoot a little forward, perfect. So I'm going to look at your arms here. I'm going to pull these back up. Okay. Great. That's fine. Doesn't have to be all the way.
Okay.
All right. So I'm going to just palpate. Everything feels nice and even. The skin is warm, dry, no masses or lesions. The skin's appropriate for ethnicity. We felt the carotid pulse or the radial pulses earlier. Good cap refill, brisk in each finger. Good. Okay. So I'm going to have you, actually, never mind. And I'm going to just look at your legs here. This. So nothing, no masses or tenderness. Does anything hurt you when I touch? Okay. The skin's nice and warm and dry. And the cap refill is brisk in each of the toes. Sorry. I'm going to feel a pulse here. Nice +2 even regular pedal pulses. Okay. So the next thing I'm going to have you do here is while you're sitting up, just press against my hand with your head. Good. And then this side. Good. And shrug your shoulders. Great. Can you hold your arms out for me like you're carrying a box? Good. Keep your eyes closed and count out loud to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Great. Squeeze my fingers real hard. Pull in towards your chest. Push away. Good. Okay. You can put your arms down. Thanks. So I'm going to have you next just pull back on my hand. Good. Push out. Good. Same with this. Pull back. Good. Push out. Good. Push. I'm going to have, can you lift your foot up? Thanks. Push down like gas pedals. Good. And pull your toes to your nose. Okay. Any numbness or tingling anywhere?
No.
Okay. Next I'm going to do is kind of touch you with this. So it's going to feel either sharp or dull.
Okay.
Okay, so I'll have you close your eyes and tell me which one
Okay.
you're feeling. Ready?
Sharp. 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 Sharp.
Okay.
Sharp. 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 Dull. Dull.
Okay.
Dull. 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 Sharp.
Mhm.
Sharp. Dull. Dull.
Okay, great. While you're sitting here, I'm gonna pull your sleeve up. Good, and just relax your arm as best you can. Good. And this one. Actually, I'm gonna go around here. Thanks. Okay, so just curl of our fingers down here. All right, and now I'll have you face forward for this. Good. Sorry, was that hard?
That's okay.
Okay, so we have +2 deep tendon reflexes. Next, I'm going to have you just stand up for me and just stand there with your eyes closed. So I'm not seeing any tremors. Our balance is nice and even. If you could, you can open your eyes and just walk forward for me and then turn around at the wall. Good. Nice and steady gait. Okay, so I'm gonna have you next touch your nose and touch my finger. Go as fast as you can. Good. Good, and switch hands. Good. Okay. Okay, good. If you need to hang on to me for support, you can. I want you to take your heel and drag it from your knee down your shin. Good, and then the other one. Good, good. Okay, so take a step towards me and I'll have you face that way. I'm gonna look at your back here, or stand straight up first. Okay. So the scapula nice and even, so are the shoulders and the hips. The skin is appropriate for ethnicity. There's no like moles or lesions or masses that I'm feeling. Any pain when I touch your back?
No.
Everything feels nice and smooth and symmetric. Okay, so bend forward a little for me, and the spine is nice and straight. Good, you can stand up. We have the convex and concave curvature of the spine here. And I think there's one more thing. I'm gonna have you sit down one more time, and I'm gonna just see your, hold on to your right foot here. Okay, it might tickle.
Yes, it does.
Sorry. And then this one. Okay, great. Okay. So I think I asked you this earlier. Any numbness or tingling anywhere?
No.
Okay. All right. I think that concludes our visit for today.
Okay.